Getting off diuretics reverses new onset diabetes. The water pills that we take, the HCT or HCTZ, and probably Lasix also, drop blood potassium, and that makes the body insulin resistant and predisposed to diabetes. It also lowers magnesium. Now, whether it has a basic intrinsic effect, whether diuretics have basic intrinsic effect that predisposes to diabetes other than through potassium and magnesium, I do not know. But I do know that some of those effects are modified if you take magnesium and keep magnesium and potassium and keep those levels on the higher side. If you want to know what your magnesium level is, you should get what's called a red blood cell magnesium. That's sort of the final best test. A blood magnesium, the standard serum magnesium, is not as accurate as a red cell magnesium, but it's a good marker and less expensive. So I would say your blood magnesium should be 2.1. Every vegetarian that I take care of, and that's not eggs and that's not fish, but every whole foods vegetarian I take care of has a magnesium level that's up around 2.3, 2.4, 2.5, and those are the good levels. And the reason is whole food vegetarians, vegetarian whole foods like brown rice, vegetables, beans, fruit, nuts, and seeds are full of potassium and full of magnesium, and that's why you don't get deficient when you eat the fish or the chicken or the meat or the cheese or the milk or the pasta or the processed breads and so on. Then you're losing some of that magnesium and potassium, and as a result, that predisposes not only to high blood pressure, but also to lower magnesium levels, which therefore means increased risk of diabetes. The birth control pill use is linked to the development of atherosclerosis. Atherosclerosis is what causes peripheral arterial disease, heart attack, and stroke. I've been sort of against the birth control pill. Everything is cost and benefit. It may be better for you not to get pregnant, for a woman not to get pregnant, and to use this, but nothing is without a downside. Also, the birth control pills tend to put weight on women, and that increases the risk for hardening of the arteries, high cholesterol, high blood pressure, and diabetes. This is about the treatment of Bell's palsy. And Bell's palsy is usually treated with something like acyclovir or Famvir or Zovirax in addition to prednisone. And what they found out was that the antiviral was not helpful, and that what really did the good work was the cortisone. Heart attack induced by appetite suppressants. Now what, phentermine. I guess phentermine is a legitimately prescribed appetite suppressant here in the United States, and it shows a heart attack, I believe, that occurred after the use of, maybe it was phentermine, maybe it was sibutramine, Meridia. 3 minutes left. Here, this is an article on beta blockers. There is a new beta blocker that I've become experienced with, and one of its interesting effects is that it increases nitric oxide production. Nitric oxide is going to be a word, or two words, you're going to hear about in the next couple of years. Nitric oxide comes from chocolate. Nitric oxide comes from L-arginine. Nitric oxide is in part what's related to the effectiveness of Cialis, Viagra, and Levitra. And nitric oxide is produced by this new beta blocker called Bistolic or Nebivolol. And like I say, I attended a conference on that. It was very interesting. And I think that even though there are, I don't know, 10, 15 beta blockers on the market, I don't know, maybe it's 5. But it's an old drug, and people are very used to those. Coreg was the darling before. I think Bistolic is going to have a location. Here is an article on how a tetracycline called minocycline is helpful to the brain of people with AIDS. Here's an article on the use of magnesium for treating heart attack, and it was found to be very good. The heart loves magnesium, and it opens up the blood vessels, acting like a calcium channel blocker. Here's an article on aspirin resistance, and it says many patients are aspirin resistant. Is that it? No? Got to finish up? Okay, good day. God bless you all. Oh, we got 1 minute left. So here's an article about reducing dementia and Parkinsonism by the use of Lipitor, Vytorin, Zocor, and that's it.